So this video is going to show you how to plan and design a surgical guide for our 2-implant overdenture workflow here at ASDO. So the first thing you got to do is log into one of our 3D lab computers. Those are found either in the PROS clinic or in our digital dentistry lab. And the password is found on the monitor stand. So once you're logged in, go ahead and launch 3shape Unite. Click on Administrator and then type in the 6-digit PIN. That password can be found on your keyboard. Go ahead and type your patient's name. If your patient doesn't show up, then you can add their name by clicking the button there. If their name pops up, you can click on their name to open up their case, and then you're going to hit New Case to start the implant planning. From here, click Implant Studio. Under Implant Studio, click the jaw that you're interested in, which is our mandibular jaw. Guide workflow. Go ahead and hit Dual Scan Protocol and hit Save. You can hit Next to move along the workflow. From the top icons here, go ahead and click the Scan Import button. And then from here, we're going to load our data. So the first thing that we're going to add is a lower denture CT scan. From here, you're going to click on the Z drive and look for 3shape Implant Studio DICOMs. You're going to search for your patient's name. And under the patient's name, you should have two names listed under the same date because they scan both the denture by itself and also the patient's jaw while wearing the denture. So in this case, we're looking for the denture CT scan. So one of the folders should have the patient's name with the arch listed. So in this case, it's the mandible. Double click that, and then you can load the denture scan. Go ahead and hit Select. And then what you should see is the denture on a platform with the radiographic markers on there. So click on Import Patient CT, and then you can go back to find the other folder, and then you can load the patient's jaw scan while the patient is wearing the denture itself. So here you should see the mandible with the radiographic markers again. So once both of those are loaded, go ahead and hit Next. Okay, here you can hit Accept. And this window here is to crop out any of the data that we don't need. So with the CT scan, there's some extra data. So you can click on the corners here to decrease the volume that's displayed here. You can also go to the bottom windows here and grab the corners. If you want to move around the arch, you can click the center button here to kind of scan through. What you want to make sure of is that you don't cut out any of the critical data, which is your mandibular jaw plus the radiographic markers that show up on these slices. So we'll hit Next, and we can do the same with the denture. With the denture scan, you have to look at these bottom windows here, and again, scroll through to make sure that the cropping doesn't crop out any of your denture. So go to all the different views just to make sure that all the data is there. So the next window is going to automatically populate the denture segmentation. From here, we can see that the scan did a good job capturing the contours of the denture. So if everything looks normal, if it looks like a denture, go ahead and hit Next. This window here establishes the panoramic curve. What you want to do is click on these circles to straighten out and level out the plane. And then you want to look from the sagittal view too, and then you can tilt this so that it somewhat approximates the occlusal plane. So remember, the occlusal plane has a little bit of a cant upward as it goes posteriorly. So you just want to mimic that. And as you do that, if you look on this axial slice, the computer automatically establishes this panoramic curve. If you need to adjust it to recenter it, you can click these yellow buttons, but the computer and the software does a good job of automatically detecting that. So what this allows you to do is to establish the curve in which you would run through the slices as you take a look at the implant planning. So go ahead and hit next. And the computer does a good job of automatically lining up the radiographic markers. But if there are any unassigned or unmatched marks, you can go ahead and click the dots to match those up. So click on manual alignment, and what you can do is scroll through the panel here and then get to a cross section where you can see the radiographic marker, and just make sure that the outline of the denture corresponds to the mark there. So as you scroll through, you can see that all those dots match up really accurately to the radiographic markers on the denture. So if everything looks good, you can go to the confirmation screen here and then hit the check mark, and that'll allow us to move on to the next step here. Again, the software generates the gingiva detection. If there's any missing areas here, you can click and just highlight the missing areas to fill in the soft tissue here. So hit next, and this window here is to detect our inferior alveolar nerve. So the best way to do this is to go to the panel, and then you can click and drag until you get to the mental foramen here. So you can see that there's the different color windows. So there's a tan one that gives you the tangential view, and then the orthogonal view in that light blue. So if you need to manipulate the windows here, you can hit the mouse wheel, and this allows you to pan. If you scroll the mouse wheel, that allows you to zoom in. So once you've found the mental foramen, go ahead and click on the radiolucency, and then now you can hold down the control button, and then you can scroll with your mouse wheel. So you can see how the slices move as you scroll through. So as you move posteriorly, you can follow where the dot is, and that follows the IA canal. The other view that you can use is the tangential view. So again, to hold down control, and then you can see as you scroll through how that tan line depicts where you are in the cross section. So oftentimes you can find a nice clean cut here where you can easily go through and fill out the rest of the nerve. So that completes out the right side. We can quickly do the left side. So again, we'll scroll, find the foramen. We can go to tangential view and then click through to mark the nerve. Once you've completed that, go ahead and hit next, and we can start planning our implant placement. So before we start planning the implants, I wanted to show you a few features in the software. So if you wanted to rotate the 3D object, you would right-click the mouse button and you can rotate. Clicking on the center wheel mouse button will allow you to pan, and then scrolling with that same button allows you to zoom in and out. So if you hover over these windows, you can do something similar. So the wheel mouse button as you scroll will zoom, and if you hold, you can also pan. The other feature that you can do is if you hold the control button and then you scroll through, this will allow you to go slice by slice around the panoramic curve, and then you can also do something similar in this tangential view. The icons on the right allow you to change the transparency and even turn off certain objects. So this will be helpful during the implant planning process to visualize the implants in 3D space here. Okay, so we can start planning the implants now. So you want to come to the left here and then just hover over the tooth that you want to place the implant in. So we'll click on 22 and hit that green plus sign. So this will pull up the different implant systems that we have available at our school. So we have a Straumann bone level tapered, and then the Zimmer TSVT are the two systems that we predominantly use here. We'll start with the Straumann, and on the columns here, these are the diameters available, and then here in the rows, these are the lengths. So a good starting point for us will be 4.1 by 10. It's a pretty average diameter and length. We could always change those settings as we go forward here. So we'll click there. And for a 2 implant overdenture, we ideally want the implant somewhere between the canine and lateral incisor. So if we click on this panel view, we can move our window here to about between canine and lateral. So based on this view here, we want to go to this orthogonal view, and then the first click is going to establish and lock in the coronal position. So we'll put the implant right about there, and then the second click will establish the orientation or the angulation of the implant. So we'll click there, and that locks that in place. Now we can still move the implant. So if you click on the implant, you can click and drag, or if you want to change the angle, grab the red circle and you can move it that way. What you'll notice too is that this implant has this green outline here. So this is a safety or buffer zone. So this dimension is set at 1.5 millimeters, and then this apical distance is set from bottom of the implant to the point there at 2 millimeters. If we want to change those dimensions, you can go up to this custom safety zone, click the box, and then we can change this dimension. So for our radial distance, we'll just move it down to 1 millimeter. So our buccolingual bone, we want at least 1 millimeter from our implant. So based on this implant dimension, we can see that the outer line just barely fits within our bony housing. In fact, we may be just a little bit short here on the buccolingual. So if that's the case, we can go back to the implant selection here, and then let's click on the Zimmer implant because they have a 3/7 by 10. So that buys us just a little bit more space here in terms of getting enough buccal and lingual bone surrounding the implant. So we'll change that to 1. And then here, our implant is fully embedded in bone, and we got at least 1 millimeter on buccolingual. So that's a pretty good position for us. Let's look at it from the occlusal view, and we can see the orientation of the implant there. The other thing that we want to look at is that the implants, when we place both of them, should be relatively in a straight line in this anterior portion of the mandible. If the implants are too far posterior, then you get this anterior cantilever when you bite in the front, and it'll tip the denture a little bit more than it really needs to. So you kind of want to visualize it by drawing a straight line in the anterior portion, and usually it's going to land kind of in this position here between canine and then to the lateral. So there's some flexibility there. Okay, so let's add our second implant. So this will be tooth 27, and we'll stick to the same implant dimensions, 3/7 by 10. We'll reset the custom safety zone to 1 millimeter. And then now we want to go to canine lateral on the other side. So we'll go there for now. We'll set our orientation. And if we want, we can go to this view and keep things somewhat symmetrical. So we'll check the line here. Yeah, so that looks about right. So we'll go to this dimension here, or this view, and it looks like we got sufficient bone. So this area looks a little bit wider, so we're a little bit more flexible. Okay, so that looks good. The other thing that we can do is look at the relative heights of these implants, so the vertical position. So if we turn off the teeth here, and then this allows us to change the transparency of the bone, and we can see that these two implants are at slightly different vertical positions. So the easiest way to move those to the same position is to look on this axial view. So we can line up this cross section to the very top of the top implant. So you'll see in this axial view that implant starts to appear right about there. So we know that the 27 implant can be moved a little bit more coronally. So we'll click on the 27 implant and then start to drag that coronally until it appears in this axial view here. So now when we look at it, it looks like her implants are at about the same height there. Okay, so that looks good. So one of the other things to do is to spin around the implant here. So when we click this implant aligned plane, you can hold down the control button, and that allows you to spin around the implant 360 degrees. So as we keep going, we're ensuring that the implant has adequate bone surrounding it. So by looking at our buffer zone, as long as the buffer zone stays within the bony confines, then we know that we have enough bone surrounding that implant in 360 degrees. Okay. Something that you can do to fine-tune the placement is if you look at the cortical bone here, which is a really radio-opaque features the bone, this implant is a little bit into that hard bony structure. So one thing that could make that surgery a little bit easier is if we kind of orient that so it's a little bit more in the cancellous bone, which is easier to drill and make our osteotomy. So that looks pretty good. Okay, another feature that's available is to parallel our implants. So we can see the angle that the implants are deviated from each other by toggling on and off this measurement tool. So right now they're 2.3 degrees off from each other. So if you wanted to make those perfectly parallel, you can group them together. So select the two implants, and then the green arrow signifies the implant that you want as your reference implant. So in this case, we'll choose number 22 as our reference implant because that's where it's more narrow and we don't want that to move. Whereas 27 is a little bit more wide with the bone, so it's got a little bit more flexibility. So when you click this button, pay attention to implant 27, you'll see it move, and now the two implants are perfectly parallel to each other. You want to do this paralleling towards the end of your implant planning. You want to set the relative positions first. So once you've paralleled them, you want to minimize any tipping or tilting of the implants. In fact, if you start tipping the implants while these two buttons are still selected, the two implants move together. So if you wanted to move the implants individually, you got to make sure that that is unchecked so you can move just the one implant by itself. So if you needed to make any adjustments, ideally after you've paralleled them, all you're doing is bodily moving the implants by clicking and dragging. So you can move the implant, but the angle between them stays the same. So the more parallel the implants are, the better in terms of less wear on the nylon components of the denture as you take it in and out each time. Okay, so we'll do our final check here to make sure all our parameters are satisfied. So we'll take one last spin around. So 27, since we paralleled it to 22, sometimes it does change relative to the bone. So we want to take one last spin around to make sure we got enough bone around it. That looks good. So the two implants are in a straight line in the anterior segment of the mandible. The heights look at about the same distance. And then the other thing we want to look at too is when we turn on the denture, we want to see that the exit or the orientation of the implant is ideally in the thickest portion or the widest portion of the denture. So all our implant components are going to be embedded in here. So it's more ideal to have that centered versus if you're, let's say, through the lingual, the denture gets a little thin there. So you can kind of play around with that to idealize that, with the caveat that, of course, you still got to stay within your bony parameters. So this takes precedence over the angle relative to the denture, because the denture we could always bulk out and thicken in certain areas if we had to. Okay, so implants are parallel. One of the things too to look at is the vertical position we have, even with both implants. And we intentionally put it subcrustal because you see how narrow and knife edge this ridge gets to. So fairly common for these implant overdenture cases to require some amount of alveoloplasty to get to the width of bone that we need. So if we wanted to communicate to our surgeons what that distance is, we can use this measurement tool to measure how much bone we got to plasty. So that's this tool here, and you just click the top of the implant to the top of the ridge, and if you wanted to delete that measurement, you can just click this delete button. The other parameter to think about too is the distance from the implant platform to the incisal edge of the denture. So this needs to be a minimum of 12 millimeters. So the reason for that is all our implant components with our locator, metal housing, needs to be within this denture. So if this is too short, then there's not enough room for all those components, and that denture gets thin and it gets a little weaker. So you need to place the implant deep enough to establish that minimum of 12 millimeters of restorative space. Okay, so we'll finish up with finalizing our surgical guide design. So what you want to start with is turn off the surgical guide for now and just have the gum tissue turn on. And what you want to do is hover over the sleeves, and you can grab this green button and raise the surgical guide sleeve so it's above the gum tissue. This is going to allow you to seat that surgical guide without interference from the tissue. We can take these green circles and just minimize the radius of these so we can minimize kind of the footprint of that surgical guide portion. So if we click here, we'll do this other one, and again we'll minimize that circle, and then from the bottom here click this green circle. Sometimes it's hard to see, but you want to raise the cylinder so again it's minimized here. Okay. So once that looks good, we got both sleeves above the gum tissue. Now we can turn on our surgical guide, and this is what it's going to look like once it's printed out. And the last thing that we need to do is then just add our ID tag. So you can put the patient's name and then set it right here. So once you have this done, you're going to need a few people to look at this surgical guide and implant plan. So with this software, if you need to go back at all, you can easily go back and make any changes to, let's say, implant position. If you want to change the length, you can do that. And everything that you change gets updated at these subsequent windows here. So don't worry about doing anything that's kind of irreversible. The software does save automatically by itself. So again, you don't have to worry about hitting save. And even if you close the program, you'll be able to recover the files here. Okay. So at this point, once you've placed the implants where you think you want it and designed the surgical guide, you're going to grab a periodontist and a prosthodontist to look at your implant positioning, and then you'll also have Darcy look at the surgical guide design, and she'll help you make any changes to the surgical guide itself. And then you'll have our process assistant look at making sure you have all the codes and paperwork done correctly so you can have this surgical guide fabricated. So there's a sheet that will have all those signatures that you got to fill out. Once you have all those filled out, then you are going to be ready to print out and finalize the surgical guide and then have the patient scheduled. So once everything looks good and you got all the approvals to actually get the files out, we hit next, and then you'll check the approved planning and approved surgical guide boxes. Once these are clicked, this finalizes it and you won't be able to edit it anymore. The only way to redesign is to make a copy of the case, and then you can restart there. So yeah, that concludes our little tutorial on making a surgical guide for our fully edentulous cases.